or get my computer. What's up, everyone? Happy Wednesday. Happy Live at 5. It's 5 p.m. A lot of great questions I saw have already been submitted. So if you're just tuning in, I will get to your question. I'll answer them all in order. There's a small little question mark on the bottom. So if you click on that question mark, then you could submit your questions. Okay, so here's the first one. Do I need pain medicine with my revision? Yeah, of course you need pain medicine with any surgery. I don't want to feel pain. So there's two major ways I treat pain. Number one is ibuprofen, Tylenol, Tramadol. Those are oral pain medications. The second way that I treat it is with Exparel, which is, we call it the pain shot, which is a long-acting local anesthetic, which we inject onto the abdomen. So yeah, it's a good idea to use. Hello, hola, California. It's a good idea to use pain meds with any surgery. Okay, so now let's see. Here's another question. Can you make extended tummy tuck scars thin, low, in the same shape on both sides, or it varies? So I think this is a good question because, you see the nice low tummy scar I use is kind of like a smiley face or that kind of like long curvilinear incision. It's not a straight line. I try to put it as low near the vagina as possible, and then it curves up on your waist. Now, I try to make it as symmetric as possible, but sometimes the body heals differently, and sometimes your body is not the same as on one side as the other. I've also noticed that people don't realize that your hip bones are different. Some women, they have a tilted hip like this, so one side is higher than the other. And sometimes it's your posture. When you stand straight, your hips are straight, but a lot of you guys slouch or do different things. So I try to make the scar as kind of symmetric as possible, but remember, the human body is not symmetric. A lot of people are saying, like, what do you mean by that? What I mean by that is if you really look closely at your face, and don't look at your face in a mirror, look at your face in a photograph, you'll notice that one side of your face is longer than the other, and one eye is slightly smaller than the other. And really beautiful people, if you reflect one side of their face to the other, it's very different. So we as plastic surgeons, we sometimes use computer software where you take someone's right side of their face and then you mirror the right side, or you take someone's left side and you mirror the left side, and it looks like a completely different person. And you, like when you compare double right to double left, and you say, well, why is that? It's because the side of your face from one side to the other is different. And that goes for your breasts, that goes for your hips, that goes for your tummy, your arms. And usually these differences are small, but if you really analyze them in photos, you can see a lot of differences from one side of your body to the other. Oh, wait, I skipped that. Oh, I missed that question. I'm sorry. I got carried away. Okay, so next question, what is BBL range? So BBL start at 6,900, and then, depending on whether or not you're adding another procedure, the second procedure is always 50% off. But just a basic BBL. Also, all BBLs that I do include a Lipo 360. So I don't know, maybe other clinics charge for the Lipo 360, but I don't charge extra for that. Okay, let's see. When doing a mamacita makeover, does lipo get done on the stomach or the mons pubis or just the back? So guys, a mamacita makeover is when you do the breasts, the tummy, and the BBL, which I love, doing those together. So that includes lipo 360, which is your waist all the way around. Remember, tummy tuck includes the flanks, and BBL includes 360 lipo. If you want the mons pubis area lipoed, I'd have to, make sure you submit photos of the mons area, and I will take a look at that. Okay. Oh, these are very personal questions. I graduated from residency in 2017, and my age is a secret. Just like my plastic surgery resultados excelentes, it's a secret. Let's see. What was the craziest surgery that you ever did? So I was involved in Canada's first hand transplant. I was still a resident. And that was probably the craziest surgery I ever did. It was like 24 hours, 2 teams of surgeons. It was a real hand transplant. A nurse who had lost their arm in a motor vehicle accident. And I can talk about this because this was all in the news, no problem. And then there had to be a matching donor for her arm, and we actually reconnected using a donor arm, the blood vessels, the nerves, the veins, the bone, and now she has a functioning working hand for transplant. It's amazing operation. Okay. Let's see this next question. If a client needs a breast reduction lift but is not sure about an implant, what would you recommend? So a lot of patients go back and forth with this. I get it. If you want a natural result, just do the reduction and lift. It's very natural. You don't have to worry about the implant. Don't have to worry about problems. If you want to have fullness in the upper poles of the breast, in the upper chest, then you should get the implant, okay? So everyone's gonna have a different answer for this. Also, if you have large natural breasts, they're just low, then we can lift them and give you very nice breasts. You don't need an implant. A lot of people think the only way to get, large breasts is with an implant, but if you already have large breasts, you may not need an implant. Lipo 360 is included with the Mommy Makeover. Kenneth Bev, how do you feel about people going to foreign countries to get plastic surgery? I mean, it depends. I don't have no judgments. It was very interesting when I was a resident and when I was learning as a med student, a lot of people, criticized patients for going away for plastic surgery. And I'm always a critical thinker. I'm like, why are they criticizing these people? If there's a good plastic surgeon that's doing it for a cheaper price in another country, why wouldn't you go? You know what I mean? To me, it's like, it's a no-brainer. So, a big part of my practice here in Miami is I treat patients from all across the United States, because in a lot of places in the United States, plastic surgery is way too expensive and it's not very good. So I think if you can combine those two things, a lower price or more value price with an excellent service, what's wrong with that? And I think it's very unfair to paint every country with the same brush. There's excellent surgeons in Colombia. There's excellent surgeons in Brazil. There's excellent surgeons in Mexico. There's excellent surgeons in Poland. It really depends on the surgeon you go to. Just because you go to a surgeon in the United States does not necessarily mean they are safer or better than the best surgeon in another country. Where there is a difference, and this is where you have to be very careful, is that in some countries, the regulations are not as strict as they are in the United States and Canada. So safety is not as well regulated. What does that mean? You have a higher risk of getting an infection, you have a higher risk of complications, and you have a higher risk of your surgeon not being competent in what they're doing because the regulations are not as strict. So I would say buyer beware when you travel to a foreign country. Oh, this is great. Just did the surgery this morning, feel great. Awesome. I'm glad you feel great. No, she wants to. Thank you, Dr. G. You're awesome. Oh, you're welcome. Okay, so here's a good question. Do you automatically get a reduction with a lift if needed? So remember, when we lift the breast, we always are taking out that skin on the bottom, that's saggy, and that breast on the bottom. So no matter what, with a breast lift, your breast is getting a little bit smaller. A reduction is when we're actually going to take more breast tissue because your breasts are too heavy. So I've had women that say, I just want to lift, and I see that they have shoulder strap grooving, they have neck pain, they have back pain, and I say, well, what about a reduction, to help you with those symptoms? And they're like, well, I didn't know that was an option. Yes, if you have back pain and neck pain from really heavy breasts and you get your shoulder strap grooving, then let's take some weight off of your chest. Let's remove some breast tissue, and then you'll have less neck pain, you'll have less back pain, you'll have less weight on your shoulders. So the idea, what you guys need to realize is when you do the lift, I'm just changing the positions of the nipples and I'm removing extra skin. When I'm doing a reduction, I do the same thing, but I am taking more breast tissue to reduce the weight of the breast. Every reduction includes a lift, but not every lift includes a reduction. Are you following me? Here's a nice, I think this is my patient. Alluring bubble adventure. 6 weeks post BBL. Can I start using bike treadmill? Yes. After 6 weeks, you can go back to your normal exercise routine, normal activities. Just remember, after 6 weeks, you're going to be a little bit weaker and a little bit out of shape, and your booty is going to be a little bit maybe tender or stiff. So, keep getting your massages, and yes, get back in the gym. I love it. Here's a question by Coco Beyonce. How long does out-of-towners have to stay before flying back home. So you have to stay in Miami for 1 week, okay? That's the minimum. Why do I have to stay in 1 week? You'll be like, I want to get my booty and I want to fly. Or I want to get my mamacita makeover and I want to go. No, you don't. And I'll give you 2 reasons. Number 1, I have to see you after surgery. And I want you to get massages. I'm going to give you 3 reasons. I have to see you after surgery, okay? So that's number 1. You can't leave right away. I want to see you within a couple of days after surgery. The second thing is you need 3 massages. And I want them done by my people in my clinic that make sure that you're doing well. And the third reason is blood clots. If you fly before surgery, you have surgery, and you fly right after surgery, your risk of blood clot is unacceptably high. So what you need to do is after surgery, if you're flying in, we're gonna put you on blood thinners, we're gonna give you compression socks, and you're gonna be walking and making sure you don't get a blood clot after surgery. Okay, so that's the 3 reasons. And I hope you like those reasons. What is this? Can I shower today? If you are 1 day post-op, no, you cannot shower. You need to chill, go to bed. And no, you're not bleeding a lot after liposuction. You are draining fluid. Remember, guys, after surgery, and you have a liposuction, I leave the holes open and you drain lots of fluid. People's like, oh my God, I'm bleeding. No, we give you padding and you are leaking fluid. If you have 1 drop of blood in a liter of fluid, it stains the whole liter, pinkish, reddish. So drainage after liposuction is completely normal. And no, you should not be showering after post-op day 1. You should be showering after maybe post-op day 2 or 3 at the earliest. Okay. There's a question we get all the time, D-Bells, when can we take off the compression socks? So I want you to have the compression socks on until you fly home. So you're gonna you can take them off to shower when you're here on day 2 or 3, which we just talked about, and after 1 week. So when you fly home to wherever is home and you get home from the airport, you can take the compression socks off. I just want you wearing them during your flight home. Why am I so strict about that? It's because of blood clots. I don't want them. It's Smiley Pam. Oh, I'm Smiley Pam. I have a beer belly. Can you do lipo and tummy tuck at the same time? Yes, I can. So number 1, stop drinking so much beer. If you have a big beer belly, that's unhealthy for you. And if you're drinking too much beer, that's unhealthy for multiple reasons. So stop drinking beer and you can help with your beer belly. If you want to do lipo and tummy tuck, all my tummy tucks include liposuction of the flanks. If your belly is too big, I might ask you to lose weight. And yes, it's safe. I do lipo with all my tummy tucks. Yes, Sonia, exactly. The fluid looks crazy, but it's good for it to drain. Yeah, I leave all the patients open after lipo or BBL because I want that fluid out. And every patient at the end of the surgery, I'm like, you're gonna drain a lot. I'm gonna give you pads, put down a garbage bag. You're gonna drain a lot. And every patient's like, oh my God, I'm draining a lot. And I'm like, yes, you're gonna drain a lot. Same with tummy tucks. The night of the surgery, day of surgery, I tell you guys, you are definitely gonna have a lot of fluid in the drain, right? And then whenever there's a lot of fluid, they're like, doctor, there's so much fluid. I'm like, I know. I just want you to write down how many. It's completely normal. So guys, submit your questions to the little question mark in the bottom. And then I promise you I'll get to every question. D. Renee Watron, can you explain how to take care of the belly button after a tummy tuck? So the belly button's interesting. I think I'm leaning more and more towards belly button training. The old thing that I used to recommend for the belly button was to leave the packing that I put inside there for 3 days. And then afterwards, when you shower, just soap and water and some Neosporin, Polysporin on the belly button. Now, I kind of like the belly button trainer where you take a little plastic kind of like washer or kind of like, it's just like a stump, like a little plastic eraser head almost. And then you just put that in the belly button to make sure the belly button stays deep. The problem with circular scars, and my belly buttons are actually a diamond, it's still kind of like a circle. The body likes to close it with scars. So I like belly button training. So that's kind of what I do. Okay, let's see. Sarah Eaker, S. Eaker. How do I know if my tummy fat is internal Want a tummy tuck, but afraid I don't have a good result. This is such a good question. I can tell you this answer. There's 2 ways you can tell. There's 3 ways, actually. So number 1, whatever fat you can grab, that's external fat. If you, like, I can't grab fat up here. Yeah, I'm so in shape. But what I mean is I can't grab much fat. I don't have much external fat. But if I had a huge belly and I can't grab fat, that's internal. You can only grab external fat. You know, everyone has a little bit of fat you can grab here. That's external. But if you see you have a big belly and you can't grab fat, that's because it might be internal fat. The other test is, can you do this? Suck it in and you're super flat. If you can suck it in and you're super flat, you don't have much internal fat. If you try to suck in your gut and it doesn't move, then you might have internal fat. So that's 2 ways. What can you grab and can you suck it in? The third way is come to me. I will examine you. I will let you know if you have external versus internal fat. So that's how I do it. Let's see. The patient says, I don't drink beer. Okay, you said beer belly though. I just have stubborn belly fat. No matter how thin I am, I have belly fat. I want to be flat after my tummy tuck. So send photos to the link in the bio and I'll evaluate you. No problem. Question, do you have any openings May 13th? I have been cleared by my doctor. So that's Julia. You know, make sure, number 1, you guys, if you want a specific date or you want surgery with me, submit your info to the link in the bio. I will look at it, and Julia will deal with the dates and booking once you've paid your booking fee, which is $500. It's $500 to book the surgery. Once you've paid that, you can choose your date. We need your medical clearance. We're not going to give dates. We're not going to start working on you until you pay the $500 deposit. That's the cost of us booking your surgery and arranging it. Oh, I have 2 announcements. What about the special? Should I announce the special? So so Julia won't let me announce the special, but we do have the you special because you special. So guys who don't know what the you special is, the you special is because you are special. You're special to me, you're special to Julia, you're special to Boogie. The you special is your first surgery is full price, and your second, third, fourth, whatever you add on within limits is 50% off. You're like, what's that mean? Well, just say you're getting a mommy makeover. You get the tummy tuck full price, the breast procedure 50% off. And you're like, well, what about the mamacita makeover? Because I want a mamacita makeover. Well, then I love you even more. You're my favorite patient. That means the tummy tuck is full price. The breast and the BBL are both half price. So it's a great deal. And it's you special because you special. What I wanted to announce and what Julia is going to announce is the deposit. Oh, she just messaged me. Is that starting Monday, our deposit is going up. So up until now, our deposit has been $500 to reserve your spot for surgery. And we thought that was very fair. And we thought that was high. But obviously, it's not high enough because a lot of people pay the $500 deposit and then they disappear. They don't want to book the date. They don't want to go through with surgery. And I get it, you know, if things change in your life. But I think that with $1,000 deposit down, then maybe people will be ready to commit for the surgery. Because, you know, if the surgery, if we're putting all this work into you and we want to book you for surgery and we want to do your surgery, we want you to commit as well, the same way we commit. And I think one way to get people serious and to know that they commit is for a $1,000 deposit. So that's going to start Monday. So you might say, Dr. G, does this affect me? So if you already have a quote and it's only a $500 deposit, you still can do the $500 deposit. This is starting Monday for all new consultations, new patients. The deposit will be $1,000. Okay, so that's just for you. If you guys were thinking about getting surgery, if you were on the fence and you wanted to lock in the $500 deposit, we will we'll still accept that. After Monday, all new quotes will be $1,000 deposit. That's just to book your surgery, to hold your place. And then, yeah, let him announce the special. I mean, we have an amazing special, the U special. And I think we're going to have another special coming up, but I'm not allowed to announce it yet. So sorry about that. But this is kind of a cool special. You get to pay more deposit. That's fun, right? Teresa Horn, is muscle repair done with all tummy tucks? Yes. Muscle repair and lipo of the sides is done with every tummy tuck. Okay, let's see this. Mejio Tabulos, do you do upper back lifts and arm lifts? Yes, I do. And I like this name. So this is like you're undecided on multiple surgeons. Is it going to be Mejio Tabulos to Giancarlo, Dr. Giancarlo? Can you have internal fat in your upper stomach? So internal fat is the fat around your organs, right, guys? So remember, someone asked this earlier. The external fat is what's on the outside, what you can grab. The external fat is what I can liposuction. The external fat is what I can cut and remove in a tummy tuck. Internal fat is around your organs. So it's like a drum. Sometimes you'll see people that look like they're pregnant because they have such a big belly and they can't even suck it in. It's like hard. That's internal fat. And it's very tough to work with that with a plastic surgeon and get a good result. If you have high internal fat, the only solution is losing weight. And usually if you can get to a BMI of 25, 26, the internal fat will not be a problem anymore. Okay, I'm keeping going. Guys, use the question mark. I promise I'll go through every question. Coco Beyonce Wilson, how long do the drains have to stay after a tummy tuck and when they're removed? So my drains stay in anywhere from 7 days to 2 weeks. The average is probably 10 days. We will remove them for you if you're in Florida. If you're near the clinic. If you fly home, then we will remove them. We will remove them from you over FaceTime. Okay. And why do we have drains? We have the drains to get rid of fluid. It's a great way to get rid of fluid. So I love drains. I do tummy tucks with the plication sutures and drains because I hate fluid collections. And doing it this way, it almost never happens. And yes, this is my Pac-Man hat. Oh, this makes me so sad. So I'm still locked out of Dr. Giancarlo. I don't know if I'm ever going to get it back. The Catfish have won this round. I don't want to talk about it right now. I just get my hat. This is my hat hair, so please ignore the hat hair. Okay. Let's see. How do you feel about stainless? I think you mean drainless tummy tucks. Stainless, I always do stainless tummy tucks. I don't leave any stains. Are they riskier than using the drain? No, I don't think it's riskier. It's surgeon preference and surgeon comfort. If a surgeon is comfortable with the drainless tummy tuck, that's good with them. For me, I like to use the drain because, guys, remember, I do massages on day 1, day 2, day 3 after surgery. And, if you can get the massage on the day after the surgery and you don't have a drain, that fluid is just in there. You're sewed up. So if we have the drain there and you get the massage, you can get rid of so much swelling and you're going to get healing faster and you're going to get your result faster. So for me, doing it with the drain is a no-brainer. I've done it both ways. What is the question? Does it go towards the total of surgery? Yes. So guys, if you do an in-person consultation, it's $400 and that goes towards your surgery. If you pay a deposit, that's for your surgery. So say your surgery price is $8,000. The deposit is $1,000 to hold your place. And then the rest of the balance is due 2 weeks before surgery. But of course, the deposit goes towards the deposit is to hold your place for surgery. That's what a deposit is. It's not like an extra fee. It's for your surgery. Let's see here. I'm going through your questions. How soon, Randa 0619, how soon after my makeover can we go swimming? I'd say 6 weeks. I want to make sure every little place is closed, every little hole is closed, your incision is totally healed. And that can take like 6 weeks. And if there's any unhealed areas, sometimes people have delayed healing around the nipple, under the breast, around the belly button. If you have delayed healing anywhere, then you need to wait for longer until you're healed. Here's a question from Coco Beyonce Wilson. Do you offer a place for your patients to recover? Yes. So we have an excellent partnership with the Wyndham Hotel here in Boca Raton. They give us a good rate that we pass along to you. It also includes 3 massages. We're working on getting a more concierge experience where you get picked up, you get dropped off, and you have a caregiver set you up in bed at home. And we'll have a price for that very soon. Okay, it's kind of hard to set this up the right way, but we're working on it. MSB Suga, let me see. Is it possible to use J-Plasma to tighten loose belly skin, even if you had abdominoplasty previously? Also, are you doing in-person consultation? So yes, I'm doing in-person consultation. It's $400 and it goes towards the price of your surgery. And yes, of course, it's possible to use J-Plasma to loosen belly skin. That's the whole point of using J-Plasma. Now, you raise an interesting point. If you've already had a tummy tuck, then J-Plasma can be perfect if you still have loose skin. If you have a lot of loose skin, then maybe you need another tummy tuck. And that's going to be a decision that you and I would have to make together based on your photos and based on if you're coming in person physical exam. Remember, guys, if you're a difficult case or you've had plastic surgery before, or I need to see you before surgery, there's nothing better than an in-person consultation. I can examine you in person and see exactly what the issues are, what your skin feels like, and give you the best kind of evaluation possible. If you've never had plastic surgery before and your photos are good, then most of the times I can deal with it virtually and I can give you a very good opinion with your photos. But I in patients like this, it's making my spider senses tingle because this patient's already had a abdominoplasty and now is asking about loose skin in J-Plasma. So that's something that we need to kind of go over with a in-person consultation. Okay, let's see. Question from Stories. Does a breast lift reduce the size of the breast without a reduction? Yes, but not as much as you think. A breast lift just removes the skin and a little bit of breast tissue from the inferior part of the breast. A breast reduction aims to remove much more of the breast tissue. So if you need a reduction, then we do a reduction. And a breast lift is basically a reduction of the skin, and you're not taking as much of the breast gland. Let's see, Lynette. Labs, high RDW, does that affect? No, it does not. If it does, I love when you guys go through your labs and you ask questions. It's nothing to worry about most of the time. That's why you have doctors to go over your labs. I will go over your labs. If it's a problem, we will let you know. That's the whole point of the medical clearance. They're supposed to go over your labs and your medical clearance with you and answer these kind of questions. So the perfect time to ask this is during your medical clearance, right? Your family doctor, your PCP is going to do these tests and they should go over all the labs with you. A high RDW on its own is not an issue. Okay, let's see. Is recovery time longer with implants? My problem is after breastfeeding, mine are too big. So I'm not sure what you mean. If your breasts are too big, we should do a reduction. If your implants are too big, then we should reduce them. Please send your information to the link in my bio, and I promise you I will give you a consultation. That's the other thing, guys. The link in my bio, consultation is free. So if you submit your photos, I will look at them and I'll give you my opinion for free. Okay, that's not a scam. That's not a hustle. What that basically means is I trained to be a doctor for 15 years. I will look at your photos and I will give you my best opinion on what I think is best for you. And that's free. It doesn't cost you anything. Now, in our consultation and, our plan for surgery, I can also discuss with you, the individual plan. And that's also free. That doesn't cost you anything. The only thing that costs you money is if you decide, yes, I want Dr. Giancarlo to be my surgeon. and I agree with this surgical plan and I want to move forward and book, that's what costs $500 deposit. And starting Monday, it's going to be $1,000 deposit. And that only is charged to you after you agree with the plan and you want to pick a surgical date. Some patients are funny. They call and they want a date. They want a date before they even did the consultation. And that's not the way it works. I will look at your photos. I will see if you're a candidate, and I will give you a quote, and then we can get the dates, but not the other way around. Let's see. How long after C-section can I get a mommy makeover? I recommend at least 6 months after pregnancy is the earliest you can have a tummy tuck, and 6 months after breastfeeding is the earliest you can do a breast procedure. No problem. How long after my makeover can you lift things again? I do a lot of lifting at work. So you can lift light things, less than 5 pounds right after surgery. But I don't want you lifting anything greater than 5 pounds for 6 weeks after surgery. I want you resting. Let's see. Okay, question from, is there a huge difference between reduction and lift versus implants? Is one better than the other? No, there's no better. It's what you're looking for. So if someone has large breasts and they need a reduction, they don't need an implants. If someone wants more upper pole fullness, then they can get larger breasts. If you want my opinion, then that's going to depend on your specific anatomy and what I think would look best on your body. So that's a very general question. There is no better than the other. It's what's going to look best on your body, given your breast history and your specific situation. Babe, can you get me a juice? Yeah. I'm like dying. I'm like talking so much here. This is more than I talk all day. Okay. I usually like just operating. You guys are asleep. I listen to music. I operate. Now I got to talk so much. My mouth is getting so dry. Okay. Explain the process of lift and reduction. Does it include fat transfer and does it look full? So a lift is when your nipples are pointing down or your breasts are too saggy and we're lifting the breast. A reduction is the same thing, but we just take away breast tissue. If you want fat transfer, that's extra. It does not include fat transfer. How far, Jessica McOwen, how far out can I book my surgery? 6 months. So that's kind of the limit. If you want to book out further than that, we just want you to be ready for your surgery. And so that's, what I want you to be is to be ready to have your surgery in 6 months, because then the photos are going to be fresh, the labs are going to be fresh, our communication is going to be fresh. If you want to book out a year from now, I'm going to need new photos, new labs. I'm not going to remember, the plan. I've got to do another consultation. So to me, it just makes sense when you're ready for surgery, let's do the consultation. If you're not ready for surgery, then you're not ready. Let's do the consultation later. Oh, thank you. You're the best. Julia is the best. The wife of my life. Okay. How many liters of fat can be taken out with Lipo360 and breast aug? I think that's 4 liters of fat. You can take, so in Florida, the rules are pretty clear. You can take 4 liters of fat with a liposuction procedure. Anytime you add a large cutting procedure, like a tummy tuck or a breast lift or a arm lift, then you can only take 1 liter. So with a mommy makeover, you can only do 1 liter of liposuction. And that's why it's so important to lose weight. And it's not just because of the rules. There's no way, even in a country with no rules, like say you go to Dominican, they can do 8 liters of liposuction. It's almost impossible to get a good result safely at higher BMI. So, I think everyone, my cutoff is 32. Obesity is 30 and above. So I give that little bit of wiggle room. But really, for your own health, guys, no one should be above a BMI 30. Really, it's just unhealthy. When you're obese, you have a higher risk of heart disease, higher risk of cancer, higher risk, high blood pressure, diabetes, hip problems, joint problems, back problems. You name it, when you're obese, there's a higher risk of it. And then you add in the surgical risks. So when you're at a higher BMI, you have a higher risk of blood clots. You have a higher risk of wound healing. You have a higher risk, believe it or not, of nutritional deficiencies. So all these things taken together is why I have a BMI limit, and most plastic surgeons have a weight limit as well. Liposuction downtime. So the way I like to think of recovery is the first 6 days is the most discomfort, then the most 6 weeks, and then the most 6 weeks. The first 6 days is the most discomfort. The first 6 weeks are when you need to, until you get back to normal, the most swelling, your energy levels. It takes about 6 weeks after surgery, and then 6 months till your final result. It really takes 6 months till your final result. Listen, Linda X. Can smoking marijuana ruin your results after surgery? Yes. Smoking, any kind of smoking with a flame and your marijuana, your cigarettes can ruin your results. It can cause nipple necrosis. It can have healing issues around your incisions. It can affect the scar in the breast. So I really recommend my patients stop smoking everything 6 weeks before surgery and 6 weeks after surgery, right? And that's so important. Now, some people are like, well, I use marijuana for other reasons, not just socially, I use it for, medical reasons. Then you can take oral cannabinoids and oral marijuana pills. Just stop smoking. It's so important. And don't lead me in. People know I like to rant about smoking. Jenny Anahai, 1. Do we do anything on the lipo incisions after they close? Yes, we will give you a scar gel, and you just apply that on the small incisions. Most of the lipo incisions are like smaller than a centimeter. So the scar gel is really good. And then the second thing is keep them out of the sun, because if you keep them out of the sun, then you can, if you put them in the sun too early, they can tan really red or really dark than the surrounding skin, and then you've got a very visible scar. Let's see. I wanted to get a breast lift and liposuction in just a mini BBL. Okay, so please submit your info to the link in the bio. I promise you I will look at your photos and give you my opinion. Guys, if you just write your questions like one line at a time, it doesn't make sense to me, because it's like look at this line. It says, also inner thighs, plastic surgery, downtime. I don't know what the previous part was. I think you're just asking about a thigh-plasty. So it's the same. 6 days is the most discomfort. 6 weeks is the majority of swelling. In 6 months till you get your final result. And I recommend 2 weeks off of surgery for almost every procedure, because you really should be resting. Let's see. It's Camila Angel. How much is a mommy makeover? So a mommy makeover is a tummy tuck plus the breast procedure. There's no one set price, because it really depends. Are you getting an extended tummy tuck? Are you getting a mini tummy tuck? Are you getting a tummy tuck? Are you getting a breast lift? Are you getting a breast lift with augmentation? So, that's a variable question depending on what you're getting. So you need to submit your information, link in the bio, and I'll give you kind of my opinion on what you're a candidate for. And then when we do the consultation, I'll give you the price. Also, if you go to my profile, Real Plastic Surgery, you can look at the price list and you can do your own math over what you think you might need. All my prices are listed there. And you need to stay for a week here in Miami. Let's see. I'm Smiley Pam. What type of implant or breast procedure do you recommend for tuberous breasts? So tuberous breasts are a very special kind of breast. There's no type of implant, and there's no one solution, because every tuberous breast is different. The characteristics of tuberous breast is their shape, and they're usually asymmetric. One is very different from the other. So each person with tuberous breast we're going to require a special approach. The other thing I've noticed is a lot of people call their breast tuberous, and it's not actually tuberous. So I would encourage you to submit your photos to the link in the bio, and I will examine you. Do you recommend supplements? No, I think the most important thing is a healthy diet. So a lot of people don't know what a healthy diet is. They go to Chipotle or they go to these fast food places and think it's healthy. It's not healthy. You should be cooking so this is what people need to do. You need to be cooking most of your meals at home. And if you're not the greatest cook, like I'm not, then marry an amazing cook. And then you can eat well every day. So what does eating well mean? I mean, you already know the answers to this. It's eating more vegetables than carbs, eating less carbs than, not eating carbs with every meal, eating lots of protein. If you need a multivitamin or you need iron supplementation because you're female with low iron, then that's a great idea. But there's no special supplement. What it basically is, the most important thing is that I love saying this, you're resting, you're eating well, and you're getting lots of exercise. You do those 3 things, you'll be ready for surgery. Why? Because that's healthy. You just need to be healthy for surgery. Healthy means getting lots of good sleep, eating healthy quality foods, getting lots of exercise, and getting lots of rest. Those 4 things, you'll be ready for surgery. Let's see, BM Nati. After BBL, can you do weightlifting and cardio? Yeah, of course. Why not? But after 6 weeks. So if you want to do it the day after surgery, you're going to have bleeding, you're going to have problems, you're going to have a lot of issues. So no, you cannot do weightlifting, cardio right after surgery. But at 6 weeks, no problem. Let's see. Coco Beyonce Wilson. Do you have to have someone come with you for surgery? Yes. You need an adult over 18 years of age to leave with you from the clinic. You cannot just hop in an Uber after surgery. You can't just take a bicycle home. No, you need a companion, an adult that's going to take you home and that agrees to stay with you for 24 hours after surgery. So most I recommend usually is a family member, a husband, a girlfriend, a sister, an aunt, a mother. These are all great. If you don't have that, we have paid recovery services that we work with, and we're trying to set up a more concierge experience now. You'll be hearing more about that very shortly. Let's see. Okay, how to tell if you have a flat stomach. I don't know what that means. After an extended tummy tuck. Look in the mirror. How to tell? You just look in the mirror. Do you have a flat stomach or not? What are your hemoglobin? So I recommend at least a 10 or above. And if you're at a 10, you need to go on iron supplementation and see your family doctor prior to surgery to try and get it up to 11. Normal is 12. So I think, 10 is the lowest I would go. Jenny, do you need to put anything on the lipo incision once they close up? Yeah, I think I answered this already. But you need to put the scar gel, which is a silicone-based scar gel, and keep them out of the sun. Scars take 1 year to heal. So it's always funny to me when people want to post before and afters at 5 days. They want to complain about their nipples at a week. You are so fresh from healing. And really, it takes 6 months to fully heal after surgery. And the scar takes 1 year. So you guys need to take care of that scar for 1 year after surgery. Let's see, how many liters of fat? Oh, I answered this already. So let me see. Have I gone? No way. Have I gone through all the questions? I never get through all the questions. I haven't. Okay, here. Okay, here's one. I had a Melly Belly 2. I had a consult with you when you were in Canada. Can I still use the consult for a future surgery with you? I don't think so, because if you did a consult with me in Canada, that means that that was over a year and a half ago. So we would need to do a new consult. That's no problem. That's what you want. Things change, your body changes, weight changes, life changes. So if you want to do a consult with me, just submit your info to the link in the bio and we'll go from there. And I'm happy to see you again. It's no problem. That's always interesting to me. People feel like the consult is a bad thing. The consult is the most important time, I feel like, for me and you to get on the same page. I have my knowledge of what's possible and what's safe, and you have what you're looking for. And we meet together to see if we can make a plan to achieve that. And it's the beautiful thing about plastic surgery that there's often a few options that are going to be narrowed down depending on your anatomy, your history, and your wants and goals. And the only time we can sort that out is in a consultation. It's crazy to me here in South Florida. People will book a surgery, people will pay a price, and they've never met their surgeon, they never talked with their surgeon, and they've only sent in photos with no information, and some salesperson is booking the surgery for them, And then they wonder why they end up with a bad result. Do you know what I mean? It's because you never connected with your surgeon. You got to connect. You got to find out, what are you looking for? What is really the thing that bugs you about your body, or what's the thing you want to improve and enhance, and how much do you want to enhance it? This all takes place in the consultation. What questions do you have for me about what I think is the best? So I always think it's funny when I get these emails or I get the thing of like, what's the price? What's your date? It's like, whoa, slow down. Buy me dinner first. No, but like seriously, let's have a chat, because I don't even know. I know you guys do your internet research and you think you know what your body needs, but I can tell you every single day I get requests for things that would make you look terrible if you actually got them. Like I know one common thing is no one wants a lift. Everyone does not want this scar on their breast. I get it. But if you need a lift, you need a lift. Putting an implant behind a breast that doesn't have a lift is going to look terrible, because your breast is hanging like this, it's saggy, and then you put an implant behind a saggy breast, it's going to look, we call it in plastic surgery, the Snoop Dogg, the Snoopy nose deformity. So if you know the cartoon, Snoopy, how the breast his nose kind of hangs, that's what happens when you put an implant behind a droopy breast. The other thing a lot of people don't want is they don't want the tummy tuck. They just want the liposuction. But if you need an abdominoplasty or a tummy tuck, liposuction is not going to help you. It's actually going to make your tummy look worse. So a lot of times what you guys think you want is not what your body needs. And that's why we need to talk. We need to get on the same page. And I really need to find out what you're looking for. Okay. Melly Belly 2. I meant Mamacita. Just don't. Oh, Mamacita. Come on, Melly Belly. The Mamacita. Thank you, It's Smiley Pam. We got the Mamacita. Oh, when are we gonna make the Mamacita announcement? Are we getting that Mamacita? You know what I'm talking about.
But we don't have
Julia doesn't let me give away nothing. She is like, Julia won't let me tell you guys anything. All I can say is that there's many exciting things coming on the horizon. And we are, working hard to give you some great surprises. And let's see. She won't let me give away a little hint? No. Julia's cutting onions in the kitchen, so she's about to be crying, so I'm not going to mess with her. Okay, so let's see. Lanel's 05. How many times a week will I need post-op lymphatic following tummy tuck and BBL, and how many weeks? And for how many weeks? So after surgery, you will get 3 massages at my clinic at day 1, day 2, day 3. It's amazing. We're going to hit you hard and we're going to hit you early. And my masajistas are excelente. Obviously, they're the best. And they're going to milk that fluid out of you. With the tummy tuck, they're going to milk it into the drain. With the BBL, they're going to milk that fluid out through the back of the incisions for the BBL. And so I recommend 2 to 3 massages for the first 6 weeks. 2 to 3 per week for the first 6 weeks. And some people will need massages for longer. You may, if you have a lot of swelling, if you have a lot of loose skin before surgery, sometimes you need massages for longer. So that's the minimum. And most massage people will say that you can massage for 6 months. Okay. Let's see. How much drainage bleeding after a BBL lipo? So this is going to depend on you. Mostly it's not bleeding. It's leakage of fluid. I use a lot of fluid to get the fat out. It's called tumescent technique or super wet liposuction. Why do I do super wet liposuction? Because I like to give you lots of local anesthetic, so there's freezing. I like to put lots of epinephrine, so there's no or minimal bleeding. So this is going to vary from person to person, but there's a lot of drainage, we call it, after surgery. So we give you pads, and then you come to a massage on the first day, and my massage people are going to massage you like crazy. So that's really good. That's what you want. And let's see, Garcia, when I see people asking about earliest date and price without meeting you, it's impulsive. I agree. That is your opinion. You know what? I 100% agree. Surgery should never be impulsive. That's when you make bad decisions. The only time impulsive works is for the clinic because they get to fill up with a last minute space with an impulsive person. I think surgery, you need to take your time. You need to think about what you want. You need to talk with me. You need to do research on your own is great, but you want to also talk to previous patients. You want to have a second consultation if you really are unsure or uncertain. I do that. And here's a perfect comment. Trust the process. Let's see. I've said it before. This is my previous patient. Hi, Reshaping Leo. He saw things other practices missed in consultation. I got the best result because it was a plan for my body. Turned 40 today and look happy birthday. Feliz cumple. It's Leo's birthday. Julia says happy birthday.
Happy birthday, Leo.
Yeah, she said happy birthday. Okay, yeah. So that's great advice. Okay, here's a question I get a lot. Okay, how long should a person wait after gastric bypass surgery to do a mummy makeover? So there's two very important things after gastric bypass. Number one is you want to achieve your goal weight. So if you and your bariatric surgeon have a goal weight, you want to achieve it. It might take a year. It might take 2 years. But if you achieve your goal weight, then you are going to be presenting me with the body that you intend to maintain for a long time. And I can adjust how much skin I'm taking. I can make a plan for you, as that patient just said, an individual plan for you when you're at your goal weight. Now, the second thing is I want you stable for a year. And I think that's so important because anyone who's been through bypass surgery or been through weight loss surgery, they are sometimes you fluctuate, and sometimes your weight's going to go up, sometimes your weight's going to go down, especially in the first year as you're getting used to kind of your new diet, your new exercise, your new eating habits. And there's nothing wrong with that. That's normal. So I would like you stable at your weight for 1 year. So why am I so strict about certain things? I'm strict with BMI, I'm strict with smoking, and I'm strict with weight loss surgery. It's because I know what the right answer is. And when you make exceptions, that's when you get unhappy patients, or you get, you're making decisions for the wrong reason. There's never a rush to have surgery. And it's like, you won't hear that from surgeons often because they're like, oh, they want to book you. They want to book you. Here in South Florida, they don't care. They'll book you the next day. You know what I mean? All you need is a visa and a heartbeat. And so, I like to think more carefully before we undergo surgery together, right? Before we go on this journey together. I want to do the consultation. I want you to wait until the right time for surgery. Okay, so let's see. Christina's, I removed drain day 19. Yes, you were a long drain. That's not usual. But again, with plastic surgery, almost anything's possible. Some people can have a drain for a long time. That's probably the new record is day 19. But usually it's 10 to 11. Honestly, it varies, but the average is probably 10 days. One patient says, tell us in the group, Julia.
Maybe.
So Julia says maybe. She'll give you guys a group. So we have a really cool, Julia hates when I say that, Facebook group. It's called Dr. Giancarlo's Resultado Excelente Dolls Official. So if you guys go to the Facebook group, Julia, Natalie, Jamie, some of my patients that are on here tonight are very active in that group. We try to keep it positive. It's the internet, the Wild West. So we try to keep it positive.
No, but it's good because previous patients can help you get prepped for surgery.
There you go. So the group is really good because you can meet previous patients. You can talk to previous patients. They can help you get ready for surgery. You guys can share your knowledge. You can share your experiences, share your photos. And that's kind of the point of the group is support and education. So a few more questions. I can't believe an hour has gone by, but it has. My mouth is so dry. I've been talking too much today. Okay, Teresa Horn, do you give blood thinners to every patient? Not every patient, but every tummy tuck, yes, because of the risk of blood clots. And almost every patient that flies for surgery, unless they're getting something really small and they're young and they have no risk factors, so almost every patient gets blood thinners because of my practice. Most of you guys travel here for surgery, and I do a lot of mommy makeovers, mamacita makeovers, which are big surgeries, and I don't like taking unnecessary risks. So yes, blood thinners for majority. Oh my God, I'm not gonna get to all these, okay. Let's see, I'll try, the last couple questions is the lightning round. If my breasts are saggy from losing a large amount of weight, do you think I would be able to get just implants? Or do you think I'll need a lift? I can't see where. Or do you think I need a lift? I think you need, without even seeing you and your breasts are saying you're saggy, then you need a lift. You don't need implants, you need a lift. But if you want implants, then you can do a lift and implants. That's what a lot of people think, is that, you know, that they can get away without the lift. I was just talking about this. If you have saggy breasts, you need the lift. And the implant is optional, not the other way around, right? Because what's the problem with saggy breasts? They sag. You need to lift them and fix the sag. And then if you want to improve the volume, then you improve the volume with implants, and that's optional. Yeah, we try to keep it positive. I mean, the internet, it's crazy, man. The internet is such a toxic place, and I think it's like, you know, people go behind a screen or behind a fake account, and they just want to be bullies, or they want to be like little trolls online. And it's unfortunate. I don't know why the internet is that way. It is that way. And there's lots of, you know, of these kind of groups for plastic surgery. If you want to go be negative, there's lots of places there that you can be as negative as you want, and you'll fit in with all the rest of them. But, you know, I think the benefit of the internet and online groups is that you can build a community. You need to have the right members. You know, it's like any other community. A rotten apple can spoil the bunch. And if you have, you know, a nice community, then you can do great things. You can support each other. You can provide education. You can provide friendship, laughs, resultados excelentes. So I really think the group is going to be a positive thing going forward. But yeah, there was some dark times there. So Alluring Bubble, you were blocked from the group. So that was the old group. So if you guys don't know what happened with the old group, it got taken over by, you know, some renegades who were blocking and deleting anyone who had anything nice to say about me, and then were just being negative. And they deleted Julia from the group. It was insane. It was a wild time. So so that group got deleted. We didn't delete it. It deleted itself. And now we have our official group. So Julia runs the group. She's the admin. She will add you. All you need to do is request to the Facebook group, Resultado Excelente Official Dolls. And you just need to be a profile. If you have no friends, no photo, you're not getting in the group. If you use your real account, you seem like a real account, then yeah, you're in the group. Why not? Okay. So guys, this was a excelente live. Thank you for your questions. I promise you I will be back next Wednesday to answer your questions. As always, if you want a consultation, please submit your info to the link in the bio. And it was a pleasure. We'll see you next Wednesday. Bye for now.